So if you ask me about my experience of participating in the NGO group that was looking at a consensus view to influence capacity legislation in Ireland, I suppose a few thoughts come to my mind. One is the benefits of having a diverse group around the table. We had organizations that were representing or working on behalf of people with dementia, working on behalf of people with intellectual disability, older people, so involved with people in the aging sector as well as, and also people from a mental health perspective. So we had a really diverse group of perspectives around the table, and that meant that when we were trying to develop our recommendations, we were taking account of the impact on a lot of different groups. And I think that was really good. Another real strength of the group was the way that we had the participation of rights holders, of people who were going to be directly impacted with new capacity legislation, right involved in the discussions. This was particularly so on the mental health side. We had quite a few people involved who were mental health service users or former mental health service users who could really talk about not only the potential impact of new capacity legislation and how it could empower them, their hopes for the legislation, but also their extreme frustration at not having their human rights protected currently, and their fears about having decisions made for them over which they would have no say, particularly in the context of involuntary detention and treatment in mental health situations. So that was a real strength of the discussions, and it meant that our recommendations were grounded in reality and that we were very determined in terms of our vision for what the legislation could do. We also had the strength of expertise around the table. We had Amnesty's resources and we had the resources of NUI Galway, and that really contributed to forming our recommendations as well. So Amnesty's resources meant that they could help to sustain the group over time. They did the administrative side of the group, but they also had a legal officer who was there able to contribute legal expertise. They also were able to organize seminars where we got international experts, and that was very helpful to the process. And then NUI Galway's expertise meant that we were hearing all the latest developments consistently through the process. We've been hearing about the latest interpretations of the UN Convention on the Rights of Persons with Disabilities, and that means that we are taking account of the full potential that's there. That's been a strength. That's also been a challenge, and I think one of the senses that I take away from the whole process is that Ireland is really breaking new ground in this area, and that's exciting. It means that Ireland has the potential to lead on developing capacity legislation in line with the Convention on the Rights of Persons with Disabilities. It also means, though, that it's challenging for us, both the stakeholders, advocates, and the civil servants as well, to grapple with the fact that there aren't precedents from elsewhere that we can copy, and to grapple with the fact that there aren't set interpretations that have been agreed internationally for some aspects, particularly around mental health and involuntary detention and treatment. And so I think those challenges remain, and I think we're still going to be grappling with them over the coming years.